Hello to all of you joining us. My name is Mary Ellen Wilson. Welcome to today's coffee chat with Visiting Angels. I am the business development manager here at Visiting Angels. We provide home care support for older Americans, helping them to age safely in place. We have offices in Gaithersburg, Silver Spring, and Edgewater, Maryland, as well as Washington, D.C. As part of our ongoing commitment to our clients, our community, our industry partners, we have been bringing you bi-monthly coffee chats since, I guess, May, when we were really in the height of the lockdown. So, most of our coffee chats feature a wonderful speaker, and most of our coffee chats also um, revolve around some area of dementia, Alzheimer's, or cognitive impairment. So, I am really excited about today's, which I'll get to in just a moment. We have Dana Wentlejewski with us from Fox Rehab. That's a tongue twister.
Okay, great.
Yeah, absolutely. She's going to be introduced in just a moment, but first, some housekeeping items, of course. So we are recording this entire webinar. So if you feel like, oh my gosh, it's too much to take notes, don't worry about it. You will get a link to the recording either later today or early tomorrow. There will be time for Q&A. So Q&A takes place after Dana's presentation, and what you can do as questions pop up and you think of them, go ahead and write them in the chat box or in the Q&A box, whichever is your preference, and we will address them at the end. If you are on Facebook, hello to our Facebook friends. We are streaming live to Facebook. If you have a question, by all means, put it in the comments section and we will get to you as well. All right, so Dana, I love today's topic, understanding the behaviors of those suffering from dementia, as there really does seem to be a pattern among those that have cognitive issues. We seem to see patterns over and over again. So I'm really excited for you to address this and give us some strategies on coping and reacting and what to do and what not to do. But first, why don't you tell us a little bit about yourself? We know that you are with Fox Rehab, but fill us in on your background.
Sure. So thank you, everybody. I'm excited to be here again this morning. This is also an exciting topic to me and one that I'm very passionate about. So I am an occupational therapist. I've been an occupational therapist for just over 11 years now. I started my career in a hospital setting, working primarily with geriatrics that have difficulties with managing their behaviors. It might have come from assisted living communities or even their own homes, and they would be sent to the hospital. And as an occupational therapist, we would be working with them on a one-on-one basis, promoting positive behaviors. And so this really has grown into a passion of mine that now I've been able to bring to Fox Rehabilitation. I've been here for 7 years and now empowering our clinicians within assisted living communities and in individual homes on how to keep our older adults safe and really promoting those positive behaviors. So I'm excited to go through some of these strategies with you today.
That is terrific. Let's jump right in, shall we?
All right, so I'm
Okay.
going to share my screen.
And by the way, while you're pulling that up, I just wanted to let you know I am now a certified dementia practitioner. I passed my
Congratulations.
certification last week. Yes, indeed. Although I am on the management side of things, it does give me a better insight into what our clients are going through and what our families are going through. So very excited about that.
Absolutely. I'm having a hard time finding.
Okay, I thought that was good filler for what.
I'm sorry.
What you doing?
Here
Take
it
your
is. I
time.
got it. All right. Can you see the
Yes,
PowerPoint?
we can. It's not in slideshow. There you go.
All
Perfect.
right. Just a little bit of a delay there. Okay. So, to open, I think it's really important to take a step back and focus a little bit on some things that might be common sense, but when we're in the midst of interaction, we can lose sight of what really behavior is about. And so, when you do think about behaviors or challenging moments with your loved ones or ones that you're caring for, make sure that you're considering that behavior is really a way to communicate feelings, needs, and desires. It's a way to achieve a goal. If you even think about how we behave when we're happy or when we're frustrated or we're mad, we're eliciting these behaviors as a way to achieve a goal, as a way to maybe it's our partner, our husband, our kids. These behaviors are a way to communicate our feelings and what it is that we need. Behavior also gives us control in certain situations. I can think of my 4-year-old this morning having a fit about getting dressed. She wanted to control that situation. That was her behavior. And that was her way that she gained control. And I should tell you, she did. She did get control of that situation this morning.
Mhm.
Um, but it might also be a response to an environment. So, in the last chat that we had, we talked a lot about communication and also how our environments might play a role in this. And so, you might want to think about what is your environment like? Is it overwhelming, overstimulating? The behaviors could all be a response to this. So, we're going to dive into this a little bit more.
That
But
actually is
speaking,
very interesting. I just want to interject
yeah,
about the environment because we see the environment from our eyes, and it goes back to what we were talking about last week or 2 weeks ago. Now it's time to look at it through their eyes, and what may seem fine to us may not be. It may be very
absolutely.
overwhelming
And they
or
can't,
too
you
bright,
know,
or yeah.
your loved one with cognitive decline or dementia might not be able to tell you that sound is really bothering me. That TV has been on all day. Where is the remote? I need to turn it off.
Right.
Instead, you're just going to see behaviors. And we really have to go back to that detective role to think, okay, what is it about this environment that could be triggering these behaviors? We can go and pick up that remote and turn it off, turn the radio down. I can tell you as an occupational therapist, I have come into many homes where the TV is just on all day because they
Mhm.
don't want their loved one to be bored, right? But at the same time, that constant noise when they're usually not able to dedicate that level of attention could actually be more bothersome than it is helpful.
Very interesting. Very
Mhm.
interesting. Okay.
So let's talk a little bit more about behaviors. We tend to think about behaviors in a negative way. That tends to be the behaviors that get our attention. And so, what does that really mean? It's usually the unwanted or the disturbing actions that we call behaviors. We tend to again not focus on those happy, enjoyable moments, but oh my gosh, mom or dad had these behaviors today, and they tend to be in a negative way.
Yeah.
We might think of agitation, wandering, resisting care, repetitive questions. So we're going to go through these behaviors, talk through them, give some examples, and give some strategies on promoting positive behaviors. Again, it's really understanding why they are having these behaviors and then how can we prevent them from occurring in the future. Most of the time, solving the cause will resolve the problematic behavior, but we have to be those detectives to figure out what that cause might be. So we're going to talk just high level a little bit here with the environment. We'll dive into that a little bit more, um, and then the approach for the communication. So just some things to think about with the environment. Is your loved one disoriented to the home or to the space where they are? Do they perhaps need a sign on the bathroom? Are they hesitant to ask you where things are? And a sign would alert them of where to go to orient them to what they need. You
Mhm.
might need to think about their physical abilities. Can they make it to the bathroom? Can they get from their bedroom to the kitchen to get a snack and not be winded and tired and push them physically? So you might need to think about the distance of the home. You might also need to think about the sun. This morning, I had to reposition myself so I wasn't sitting in glare. You would not see me in a positive way with positive behaviors if I did not adjust myself.
Mm.
A loved one wouldn't be able to do that. They would sit in the glare and probably be unhappy. So, something as simple as where is that glare, where's the light, and paying attention to how that environment is set up. The other thing is smells. Don't you love it when you come into your home and, someone's making dinner or there's cookies being made or baking going on, especially now with the holidays? Think about that. That environment that smells, the lavender, the cinnamon, the chocolate, whatever that might be that they really enjoy. That's something you could think about to elicit those positive memories. And then, just overarching with the communication, and I know we talked about this a lot last time, but I wanted to throw it in here, is making sure that you are giving simple commands, something that your loved one can understand and follow. Make sure that you're not speaking too fast, that you're speaking slowly
Mhm.
and using the 90-second rule. So you're allowing them time to process what you're saying rather than repeating yourself, escalating your volume of voice, or even changing the way you're saying things. Now, with an accent that I didn't talk about this a whole lot last time, but just keep in mind that our loved ones with dementia, they do tend to revert back to their primary language. And then if you have a caregiver coming in with another accent, that could present some challenges of just understanding, which might elicit behaviors as well. So, just something to be cognizant of. And that emotion, remember that your loved ones are very tuned into emotion. They're not going to remember what you say, but they will remember how you made them feel. And that is going to be so powerful with promoting positive behaviors. So yeah, you
I
have a
did
question.
Well, I just wanted to mention, the 90 seconds, we talked about it last time as well. It's such a great strategy in so many different scenarios, but 90 seconds is a long time.
It is a long time.
Wow. And
I
I think,
challenge you to at least get to 30. Try 30. You might have to count to yourself, but I promise you, it does work.
and during those 90 seconds, let's say we're saying, are you ready for dinner? Let's just say. And they're thinking about it. Are we just standing there looking at them and waiting for their response for a minute and
Probably.
a half? Yeah,
Yeah, you probably will be sitting, keeping those pleasant nonverbals,
right.
keeping the eye contact, and I would likely say it's time for dinner. Let's stand up rather than are you ready for dinner? Because you do want to be careful not to ask a question that you don't want the answer to, because that loved one could say, "No, I'm
Good
not ready
point.
for dinner."
Very good
But
point.
it's time for dinner, stand up, and I would count. I would just sit there, smile,
Mhm.
and ideally they will get up.
Awesome.
Mhm.
Another question I have about smells. Have there been any research or studies on essential oils and diffusing essential oils like lavender or some other things into the environment to help?
Absolutely. There are certain protocols. Off the top of my head, I do not know if they are specific to older adults with dementia. But I do know that there's a lot of research just about essential oils.
In general.
There
Yeah.
is a lot of protocols that do go on, particularly in senior living, where there will be like aromatherapy. And they might pass around a basket of lavender, cinnamon,
Mm.
oregano, garlic. It tends to bring up memories for reminiscing.
Oh, that's wonderful. Okay.
All right. So we're going to talk about anger and agitation first. So let's dive into our detective hat and think about what might be the common reasons for anger and agitation. And I ask you, think about yourself. What tends to be a trigger that causes you anger and agitation? It's going to be very similar to what your loved one with dementia is having. They just can't verbally tell you. So it might be a physical reason. There might be pain, lack of sleep. I know I can be very angry and agitated when I do not get my sleep. It might be a sudden medical cause, maybe a change in medication, and that's making them feel different. It might be that they are past their level of stimulation that they can handle, maybe a loud noise level. Again, maybe that television has been on all day and they're just pacing and agitated and they can't tell you why, but if we calm the environment, those negative behaviors tend to calm as well. Um, it might also be an emotional need. They might have a need to be correct. We all love to be correct and validated. If someone is not paying attention to me, I might then become angry, escalate my voice, turn around, walk away, elicit those anger and agitated behaviors. So that need to be correct, that need to have that back and forth conversation is important. It might be environmental. They can't find the things that they need, such as something so simple as a bathroom. It might also be that they're eliciting anger because they're startled. Perhaps you approach them too far from the side. And as we talked about last time, our loved ones with dementia, their peripheral vision starts to deteriorate and they really function in a world of binoculars. And so if you approach them too fast to the side and you touch them in more of an intimate area, the arm, the shoulder, the waist, you could startle them and that could elicit an angry behavior as well. So let's look at, I actually don't think I have an example of this one, but Mary Ellen, anything that jumps out to you here?
Mhm. I think that the optimal stimulation, because again, aren't we all like that? You can take so much of background noise or the bright lights or whatnot until you just have had enough, for sure. So, and the peripheral village
Vision.
vision is very interesting to me, and I think that most people don't even realize that. And that's huge.
Yeah. So the way you
Approaching.
approach someone
Yeah.
exactly should be in front of them, giving them a nonverbal or a verbal cue that you're coming forward. Hi, Mary Ellen, I'm coming closer. I'm coming to say hi. And coming forward right in front, actually a little directly at an angle, and then being eye level is very important.
And then what do we do? So what do we do if our loved one is agitated? Do we go through a checklist, sort of? Okay, is he tired? Is he, how do you
That's a
figure
good
this out
question.
with your detective hat?
Yeah, I don't think we could probably solve it all right there in that moment, but could we prevent it in the future?
Mhm.
And can we validate the feeling that's happening now, validate and then redirect and say, it was a terrible idea that I did this. I
Right.
go back to my 4-year-old a lot because our loved ones with dementia, they
Mhm.
do tend to regress in the same way that an infant learns skills.
Mhm.
And, our children love structure, they love repetition, they need
Mhm.
sleep. I let my daughter stay up over the weekend until 10:30. The next day, she was angry and agitated. And I'm thinking, I need to make sure she gets a good amount of sleep. So I might not be able to solve it right there, but I have an idea of how to prevent it in the future.
It just reminds me, you just reminded me of, I have 4 children. They're all young adults now. But I remember with the slumber parties and the sleepover
Oh,
that
yes.
you always knew the next day was gonna be hellacious.
Right,
Ugh,
right.
God, yeah, because they were so overtired, overstimulated, and miserable.
Mhm.
Absolutely.
So all of what we just talked about, is right here. Keeping in mind the communication, your verbal and your nonverbal communication is huge. The way you present yourself, that loved one is going to pick up if you are frustrated with them. And remembering that 90-second rule and that validation, like we talked about, getting into their world. If they are upset, asking them, tell me about that. I'm sorry you're upset. Let's go do this that you enjoy. Validation is so important to all of us. It's just so easy to dismiss when you don't, your loved one has dementia because you want to move them to something better and a good moment. But sometimes you just have to pause there.
Mm.
So let's talk a little bit about this validation response and that emotional need to be correct. So I have an example here, just to walk through one. Sam insists that he did not have breakfast this morning. And I'm sure some of you that are watching today have been in this situation. And so I ask you, which reaction would you tend to do? Or one, what reaction should you do? So the first reaction is that you say, you saw him eating breakfast and you tell him that. He immediately then becomes angry because, again, you're not validating. He must be hungry if he's saying that he needs to eat breakfast still. So he is insisting that he did not eat. And you now have to spend the time calming him down. In this moment, I challenge you for a reaction two. You did see him eating breakfast, but you say, I'm sorry you were hungry. And you ask him to sit down and you get him a cup of juice and some graham crackers, and he's happy. But knowing in that moment to pause there, to validate, to give a little snack, and now you've been able to redirect.
Mm.
So let's go to another one that's very common, and this is the repetitive questioning. I think this actually came up from a viewer last week as well, that their father kept asking for things throughout the day. So there might be a physical reason behind this. Again, there's a need here, and they might be asking a repetitive question, not really to get the answer to that question, but that they need a connection. And so it might actually be a physical reason. They could be hungry. They could be bored, and they're asking you the same question because that just happens to be what they think about. But they're getting that interaction that they need. It might also be, kind of along those similar lines, an indirect way to ask for comfort. They're seeking attention. I can tell you, we had a client of ours in an assisted living that would ask to go to the bathroom about every 5 to 10 minutes. And it really wasn't even that she had to go to the bathroom, but that she was looking for that connection. And so, with an occupational therapist, we were able to find things she could successfully participate in. She had enjoyment. All of a sudden, she stopped asking those questions. She only asked when she really had to go to the bathroom. So, something to think about. Um, and then again, whose problem is it? It's really both of our problems. So it does require that we put attention here, that we really work to find what is the cause for this repetitive questioning. It might be too that they need some cues in their environment. Maybe they wouldn't always ask you where the bathroom was or where the kitchen was if they could actually find it. Maybe they need those cues. And then think about your approach. If you're asking someone a question and they ignore you, what do? You would ask them again and again and louder, maybe tap on the desk, hello, right? That same person with dementia is going to do that very same thing. So do not ignore. You want to make sure that you're validating and then redirecting. So please watch your approach. And you might get this too with very classic presentations in the beginning stages of dementia. They might really just be forgetting, rather than that need to have that engagement. And so they might just have anxiety about missing appointments, and they might need those environmental cues like a timer, a reminder, a calendar, those types of things. And that might be very short and simple way to get them settled so they're not asking those questions. So here's an example that we're going to go through. So May is driving us crazy. Every 10 minutes, she asks when her daughter is coming to visit. You've tried validating and she still asks. So here's your two scenarios. You can ignore her, but it's making the problem worse. And now she's constantly asking, when is my daughter coming? When is my daughter coming? Here's reaction two. You ask her daughter only to tell May an hour ahead of time when she plans to visit. And so you might think about this with family coming in the holidays. You might not want to tell mom or dad that you're coming a week ahead of time, 2 days ahead of time. You might want to wait and make that phone call or that announcement that morning that you're coming, or I'm on my way. Um, you can ask the daughter to make a tape stating that she will be coming soon, and you can actually play it for May. You could also have her make a phone call so she hears that voice and is validated and redirected there. Again, I think about my 4-year-old. I can't help but continue to go there. She had a dentist appointment, and I really bit my tongue to not tell her ahead of time, but I told her the morning, and we were going that evening. All day, all she did was say in daycare, I'm going to the dentist, I'm nervous. I'm going to the dentist, I'm nervous.
Aw.
And here I'm thinking the next time I can't tell her in the morning.
Yep.
A
Mm-mm.
few months, well, I would say before COVID too, last year, we were going on a trip for Florida. I announced the trip. She packed, she had her hat on, her plain outfit, but she was ready to go. And here we weren't going for another month. And so this timing was so challenging for her. And that's our loved ones with dementia. They can't process that emotion, that feeling in the time. So you might need to hold back in what you share with them. So let's talk about wandering. um, some common reasons with wandering: restless leg syndrome, that is very common to our older adults. They might also have excess energy. And so if you think about, we're going to talk about activities in the next session, which I'm very excited about. That's really my forte as an occupational therapist. If your loved one is sitting all day, they might just have extra energy and they might try to get up and just walk around. They don't really know what to engage in. And so you might just see them wandering. There might also just be an incontinence issue, that it might be uncomfortable to remain, sitting. They might walk around. Um, you want to think about optimal stimulation for that person. Are they searching for some kind of connection, and they go into an environment, a room, maybe within your home, and they're not getting that? They're getting uncomfortable, so they might get up and leave and go somewhere else, wander to that new environment, seeking for something. Your loved ones might also have anxiety, which could be a side effect of medication. So you want to just keep an eye if there's anything coming up that wasn't there before. And again, whose problem is it? It's probably a lot of people's problems, because somebody that does wander might take things. They might go in there and say, "Oh, that looks good. That feels good. That's mine. I like that. I'm going to keep that with me." And again, with that environment, they might not quite know where they need to go. And so that they're going to just keep wandering around the home looking for something that they want, that they need, but they might not know really what that is.
Mm-hmm.
You might also see, as their dementia does progress through stage 5, that there's something called sundowning. And that's something most of us are familiar with, that as it gets later in the day, you're going to see more of these negative behaviors. They're going to escalate. And so that happens to tend to be wandering as the day goes on. So let's look at an example. So Sarah likes to wander the halls. Unfortunately, she has a bad habit of going into other people's rooms and laying on their bed. So it could be, you have a loved one with you, your mom or your dad, and they tend to wander around the home and go into your children's room or whatever that might be. So here's your two reactions. You spend a lot of time looking for her. She's not easy to find because she really could be anywhere in any of the rooms. And here's number 2. You take her favorite hat and you attach it to her door just below eye level. So again, you want to think that your loved one is here in these little binoculars and their gaze tends to be 32 inches from the floor. And so if you hang something too high, they're not going to see it. They're going to miss that cue. A
Mm.
little below eye level is where their gaze tends to naturally go. And so if you put something on her door that's meaningful or familiar to her, she's going to know, this is my room, this is my safe space. I think in the last chat, we talked about too familiar furniture or pictures or items that they really enjoyed in their home. Bringing those in so it's a familiar environment to really get their attention and know that that's a place that's warm and comforting and where they should be should minimize some of that wandering. So we have a couple more. Let's talk about hoarding and hiding objects. This could also be another behavior that's being elicited because they are bored. If you think about ourselves, and I can even look at my desk in front of me, and Mary Ellen, you can look at yours, and the viewers, look at what's around you. Do you have something right by you that's yours? I do. I have my coffee cup, my paper, a pen. I put my phone to the side, but I have all these things that are mine, my chair that I'm comfortable in, that I put here so I could sit in. Our loved ones with dementia, we might put them in a situation where they have nothing. They don't have a coffee cup. They don't have a favorite chair that they're sitting in. They don't have a blanket. They don't have a pen. We tend to sit them places and say, here you go, mom. See you later. Put the TV on, right? But they have nothing that's theirs. We always have personal objects with us, always. And so you want to think about that when you're positioning someone somewhere where they're going about their day. Do they have their lipstick on? Do they have their wallet in their pocket with $1 in it or a pretend credit card, right? Did mom always wear a purse? I could tell you, I think when I'm older, if I don't have a cell phone on me, I won't know what to do. But maybe mom always had the watch with the tissue in it, right? Making sure she has the watch with that piece of tissue in there. So we tend to see these behaviors again because we're not providing what is needed. And especially hoarding, you will see that somebody needs something. So you might see they even go and take sugar packets from the kitchen. That's mine. I like that. I'm going to take this fork to my room because I used it. It was valuable to me. I'm just going to put that in my bag and I'm going to take it into my room. So you always want to have some sense of self with you, around you, and kind of on you, knowing what your loved ones used to always carry with them. And this can cause problems with everybody within the home. It's not intentional. They're not trying to steal. Your loved one is trying to find a sense of self in an environment that is usually uncomfortable or unknown in an instant. And so with that environment, they do benefit from consistency, knowing where things are, how to access those environments so that they can be successful and they might not have that need to hide or hoard items. So here's an example. Henry often hides his watch because he's afraid someone will steal it. Unfortunately, he forgets where he puts it. So I'm sure you've heard mom or dad, where did you put that hearing aid? Where did you leave your glasses? Where did you put your watch? It might become uncomfortable. And so they'll take it out, they'll take it off, and they'll just leave it anywhere. But again, it's not really my problem. It's your problem, your loved one is thinking. So you stole it. I didn't lose it. You stole it. And so this tends to reinforce a hoarding mechanism and probably some anger behaviors as well. Mm-hmm. So there's some distrust there. He can't find the watch, and you stole that. So here's your two reactions. You can tell Henry you didn't take it. He just gets more mad at you because he's pretty sure you took it. And you spend lots of time looking for the watch. Now, in this instance, this is a caregiver at a building, let's say at a senior living. So this might not be, you might not lose your job, but you might lose your wits about you and get very frustrated. And here's reaction two. You get a small shoebox and you put a big sign on it. Henry's watch box. So you label it. It's very clear. You could even put a picture of a watch on it. And you put it on the top of the dresser where he always goes and it's easy to see. And you show Henry the box and you have him put his watch in there every day. So every morning he comes and he gets his watch out of that box. Every night you take it off and you put it in that box. It simplifies the environment. And then you are accounting for that so he's not getting that angry behavior. So here's refusing or resisting care. And this might happen with our activities of daily living. that OTs do address. And this could be anything from showering to bathing to eating to dressing. These are very personal and intimate actions that we do on a daily basis. But again, they are personal and intimate. And so if they're refusing care, it might just be because this person, if you thought about us today, how would you appreciate someone coming in to help you to get dressed or you to get in the shower or to put your makeup on? You always want to put yourselves in their shoes, because these can be, challenging moments. And so it could be an issue of personal dignity and discomfort. They could be refusing to eat or resisting that meal. They might find that the food is bland. Our senses do tend to need more stimulation, a little bit more salt substitute, a little bit more sweetness. If your loved one is not eating as much, they might be able to handle higher calories per meal. I've worked with a few clients that actually will have a little dish of chocolate ice cream before their meal to really get their taste stimulated in a positive way. So then they'll go ahead and they'll keep eating. You can't really tell what they're eating, but that first taste of maybe mashed potatoes doesn't do it for them. But that little scoop of chocolate ice cream does, and it gets them wanting more. Of course, consult your providers before doing something like that, but just keep in mind that blandness of food could be happening. They could be resisting you because there's fear and there's confusion. You might have a new caregiver in the home, and just because you tell mom or dad that they're someone they can trust, it's going to take time to build that rapport for your loved one to remember how they make them feel and trust them in those moments. Um, you might also want to think about the temperature. So I know, especially in the winter, your house might be cold and you might want to get them into the shower and they just don't want to undress. So you might want to think, do I need to make the shower or the bathroom warmer for them so they will disrobe and then go into the shower? When they get out of the shower, do I have a robe that they can put right on so that they get warm again? Because they might remember, when I get out of that shower, I'm cold. I don't want to get in there. I'm cold. And so something as simple as the temperature and the environment could help um, with improving that resisting of care. It might also be that we are talking too much, that we just need to slow down. Give the 90-second rule. We're giving too many commands and it's overstimulating. And they're saying, that's it, I'm done, go away, I'm not doing this. And it might be an instant where we have to take a deep breath, reflect, leave, and come back and try again. So here's an example. Jack has been refusing to change his clothes. He's become combative when you try to help him. And you're upset about him wanting to change his outfit. You don't want to see him in the same outfit again and again. And this could maybe be you have a caregiver that's helping you, and you're a little frustrated with that caregiver too if you're not seeing them change his clothes. So, your reaction one might be that you invite somebody else to come and help you, right? Maybe that caregiver says, well, you do it. You come and you change him. Or you ask your brother, I can't get mom to change. You come in and you do it. But here's number two. Here's what I want you to try. I want you to see if you can replace the older items of clothing with clothing similar to what he now likes to wear. We might find that they have a favorite outfit. Maybe it is sweatpants and a sweatshirt. You could go and buy 3 sets of those. And so you might finally get Jack to disrobe, and you say, here you go, here's your same outfit. It might look the same, but at least it's clean. You might want to make sure that he's warm enough when he does disrobe. You could do a robe, you could do a sheet, whatever that is to control the environment. And then, giving something similar doesn't catch him so off guard. I know one client I worked with, she loved purple, and anything purple she would put on. And so that's what her family did. Got rid of those older clothes, bought some more purple items, and we were able to get her changed. So it could be something as simple as that. But here's the last one that I have for you. And this is just about incontinence, inappropriate place. This is also a very intimate and difficult situation that, a lot of our loved ones might be facing, and a lot of family members. So really keep in mind that there could be even a change in behavior, such as anger and agitation, as well as incontinence, could be from a UTI. It could be from constipation medications. That's something really to pay attention to and alert a provider if this is something new that's going on. We talked a lot already about, putting signs up around the environment. That might be something to do. And then again, just making sure that maybe you have a routine for this person in that environment in your approach, that you're giving them extra time to process. And maybe every day after every meal, you take them to the bathroom, because that tends to be when people do need to go first when they get up in the morning, after their meals, and definitely before bedtime. There's some other things that we can do too as occupational therapists, even educating on certain incontinence techniques. It could be something as simple as limiting liquids after 7 p.m. at night. Salty, sweet foods also tend to elicit incontinence and urinary frequency. So those are all things too that a skilled provider could support you with. But this is challenging. And if they do have incontinence, especially at nighttime, that can create extra work for our loved ones to keep things clean. So here is an example. We found that Edith can hold her bladder for at least 2 hours at a time. We know when she has to go, but she needs help walking to the bathroom. Sometimes you're busy. Maybe you're taking care of another child in the house. Maybe you're caring for more than one person. And so you're busy and you couldn't take her, and she does have an accident. Here's your two reactions. You know it's time consuming, but you change her and she's incontinent and you go ahead and you change her. It does take extra time, but you're keeping her clean and dry. Nothing wrong with that from time to time. The other thing you might want to consider is, again, that environment. You sit her closer to the bathroom, you label it with a picture of a bathroom, whether it's, the female sign, a picture of the toilet, whatever might work for her. You might have to try a couple things. And then you suggest you have PT coming into the home to work on her gait and her strengthening. Suggest that they get her accustomed to walking to that bathroom. And so you're working on it together then in a more proactive approach. And that might be an example. And so I just wanted to bring up again at the end here the 90-second rule, to really make sure you're giving those short, sweet, simple commands and at least counting to 30, maybe not 90, but at least counting to 30 seconds. So you're not having to restart every time you talk again and you change the words that you're using or the volume of your voice, and seeing really how that helps to promote positive behaviors. So I think, Mary Ellen, we can turn it over to any questions.
Terrific. Before I go to the question that was posted, I want to ask if you have some advice, especially with COVID resurging, with the holidays coming and all the stressors that our family caregivers may be feeling right now. What is your best advice for them to be able to keep calm and keep patient? What do they do? Maybe they need a 90-second timeout, right?
Yes.
Sometimes, and that's
Mhm.
certainly reasonable.
Absolutely. So if you are feeling overwhelmed, your loved one is likely feeling overwhelmed.
Mm.
You can process so much and triage and problem solve and turn off and turn on. So I would say if you're overwhelmed, know that your loved one is. And I would ask you to simplify whatever that might be: noise, clutter, light, stimulation. Maybe family can only visit from 10 to 12 or 1 to 3. And then we need quiet time. Or we have everyone come and everyone does do something quietly for 30 minutes. I think we all benefit from structure, interaction,
Mhm.
and then that calmness in between to regroup and reset.
I think you just hit on something else without even realizing it. With the holidays coming up, if you are having family coming to the home to celebrate, giving them a heads up of entering calmly and quietly, not, I think of my own family, they come in and it's like an explosion. So if you have adult children that do the same thing, or even grandchildren, have them make sure they come in quietly, calmly. Let dad get used to their presence again. Does that make
Absolutely.
sense?
Yeah.
Yeah.
Mhm.
Okay. Well, let's go to the first question that I see. Do some patients with dementia lose the ability to read simple things like Henry's watch box in the example that you gave us?
They might.
Good
Yes.
question.
hmm they might recognize their name, though. I mean, if you do think of a child, they tend to know their name. They might not know what those letters are individually, but they know that's their name. So you could even just put Henry and perhaps a picture of a watch
Mm,
rather than the word watch. You might find that they do rely more on symbols than the actual words.
interesting. That was a great question. Very
Mhm.
good question. Thank you. Any other questions? I am not seeing any in the chat. You must have been
Okay.
very complete today, Dana. Tiffany, do we have any questions or comments on the Facebook page?
No, there's no comments on Facebook.
Okay, thank you. All right, last words, Dana.
I thank all of you for letting me share some of these strategies. I hope you can integrate them as you see, more family members, or as the holidays are approaching, or even if you're, just trying to make these memories enjoyable, these moments. They're all so special with our loved ones. It's very easy to focus on what is lost and the negative behaviors, but we all know that our loved ones are capable of so much, and really making sure that we capture what they can do
Hmm,
and really working to promote those positive behaviors are so powerful.
that's terrific. Dana, you, as always, this was so informative, really wonderful. Folks, in 2 weeks, we will have our session number 3 of this series. Of course, I haven't flipped my calendar yet. So that will be on the 16th, I believe.
Mhm.
And Dana will be back for the third installation, which we will be talking about activities, correct?
Yes, I'm excited. I will see you all then.
Terrific. Dana, tell everyone where they can find you if they have a question that they might want to reach out to you.
Absolutely. So you can visit our website, www.foxrehab.org. There are a lot of resources on there that can help you, as well as locating a local clinician, a physical therapist, occupational therapist, or speech therapist that can come and help you and your loved ones.
That's terrific. Thank you. And of course, Visiting Angels, visitingangels.com/Gaithersburg is where you will find us. And you will find lots of links to past coffee chats with so much information. Again, we will send this recording link out to you if you want to share it with other family members or whatnot. And we will see you in 2 weeks. Thank you so much.
Take
Bye,
care.
Dana.
Bye bye.
Thank
Thank you.
you.